The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of facial rejuvenation. We're talking about low downtime, minimally invasive facelifting techniques. With us, we have a board-certified facial plastic surgeon. In fact, he's double board-certified in head and neck surgery, Dr. Derouin. Dr. Derouin, welcome to the program. Thanks for coming on.
Well, thanks for having me, Randy.
All right, now I met you about 9 years ago, which was probably about 1,500 facelifts ago. Is that right?
That's to be correct.
Or no, I think it was only, 5 years ago?
That's
or 7 years ago, your wife pointed out. But so I've been trying to get you on the show ever since. So thank you for coming on the show. Now, for people that don't know about you or your practice, tell us a little bit about it. I mean, who's a typical patient? What do you spend most of your time doing? What are the procedures you do?
Okay, well, our practice is called Dermacare Cosmetic Surgery. We're located in Goodyear, Arizona.
Okay.
We are a full-time, fully dedicated practice to cosmetic surgery. Our procedures that we have available cover the gamut of cosmetic surgery. I'm a full-time surgeon, and I dedicate my time to facial rejuvenation and total body liposuction. We also offer skin laser treatments for those people. And
your wife, I'm sorry I interrupted you, but you were about to say your wife works in the practice. She's a medical doctor.
My wife is a medical doctor. She's a board-certified physician, and most of her time is spent with facial resurfacing, lasers, with injectables such as Botox and Restylane and others.
Now, may I say, by the way, and I told her when I met her, you know, whenever you meet a plastic surgeon's wife, sometimes they can look overdone. Okay, I got to be careful because I've interviewed a lot over the years. But your wife, flawless skin.
Flawless.
Right? And natural. No pores on her face. That was my joke with it. But that's nice. I mean, it says a lot about, I guess, what you're doing there.
Well, our philosophy is to maintain a natural appearance. Most of our patients do not want the overdone, over-operated look. And we're very mindful of that. We're always trying to give them a natural appearance.
Let's talk a little bit about your background and training. And did you always know you wanted to be a facial plastic surgeon?
Well, I knew pretty early. I'm a Midwestern guy. I grew up in Western Michigan. I went to college in Michigan and attended medical school in Chicago. I interned in the Detroit area, and I completed my surgical training in Portland, Maine.
All right.
After Portland, I actually taught at Ohio University in Athens, Ohio, where I was clinical professor of otolaryngology and facial plastic surgery. I had a fellowship period in New York City and pursued further facial plastic surgery. But most of my career I spent in St. Louis, Missouri, and since 2000 I've been in Phoenix, Arizona.
So you've done over 1,500 facelift procedures.
That's correct, Randy. I've done them in my own private practice, and for several years I worked at a national company that specialized in facelift surgery.
Are you that much better now than you were 1,500 facelifts ago?
Oh, yes.
Really?
Oh, yes. It's just like shooting hoops or making putts. The more you do, the better you get. And I've been able to evolve my own technique and make improvements along the way.
Now, you have unique qualifications in both board-certified head and neck surgery and then facial plastic surgery. Tell me what goes on in that training.
Well, in our training in head and neck surgery, of course, we're emphasizing such things as cancer and injuries. So, I've taken care of broken jaws, broken noses, smashed faces, cancer of the face, parotid gland tumors, and that sort of thing. But that really dovetails quite well into facelifting surgery because it increases your three-dimensional awareness of anatomy. You understand what are the layers of a face, what are the anatomical structures.
So you think it makes it for a better facelift?
A better facelift and a better surgeon.
So what's changed over the last 20 years in the world of facial rejuvenation, facelift surgery? I mean, how is it, because we've talked off camera, that you get better results now, more natural results than ever before? I mean, what's changed?
Well, actually, many things have changed. We begin with our understanding of what aging actually is. And the facial rejuvenation is more than just a facelift. We have to consider the texture of the skin, the color of the skin, When I see a patient, I look at everything from their brow line to their clavicles. I'm looking at their brow position, their eyelids. Do their eyelids sit on their eyelashes? Do they have fat pads protruding from their lower lids? Has the tip of their nose dropped? Are their lips thinner than they should be? Has the lower lip actually elongated, as it does in many patients? We see wasting of the face, particularly with the loss of fat. That is one of the really big changes in understanding of aging, and it actually has spurned a whole new interest in fat transplantation.
Okay.
So the other things moving down, we always look at the jowls, the marionette lines, and for most people, it's the neck.
You're big on the neck.
We're very big on the neck. As James Carville used to say to President Clinton, it's the economy stupid, and facelifting we say it's the neck stupid.
Is that right? Okay.
And most people have increase in the awareness of their neck bands due to a thinning and loss of fat and a drooping and sagging of the platysmal muscle. And tightening that muscle to create a sling and smoothing out the neck is a major, major part of a neck lift, facelift operation.
Now you say you're changing people's lives. I mean, you see transformations. You know, you take care of their face, you make them look younger. You know, how many years younger can you make people look? Or have you been told?
Well, we get different inputs in that. Some people express this in terms of years, but many people just say they feel better about themselves in a qualitative way and not the how many years younger do you look.
Now you brought some photos. What are we looking at here? Are these facelift photos?
These are facelift photos, Randy. This is a beautiful woman in her 60s.
Okay.
And she comes to us for consideration of a facelift, and she says, I'm just not happy with my neck. However, when we look closer at this picture, we can see there's much.
What do you see, by the way, when you look at this patient?
I see several areas that need addressing. In the aging process, one often gets loss of fat in the face that results in droopiness in the jowls. They get more revealing of the platysmal muscle, which causes neck bands. And there's an actual change in the shape of the face. When you think of your old high school graduation picture, you had this round little cherub face. And now you have an elongated, squared off face, almost hourglass in
You said this is the reason, you told me in the green room, this is why you have to have name tags at your 10-year reunion.
That's right. We have to have name tags at our class reunions because we're just not the same person. So this patient wants to look younger, she wants to look natural, she wants to look more like she used to. So it's not just the neck in this patient. I want to restore some natural fullness in her cheek. And in my technique, I'll actually mobilize and move that tissue to fill that area.
So with her, when you look at her on the consult, I mean, in your mind, do you know the end result in your head? Do you say this is going to be good?
Yes, I do. I mean, you look at this beautiful woman and you know you can get a good result on this patient. We can.
So what did you do for her? I mean, go down the list of what you did.
All righty. So this patient had a neck and facelift. What we did for her is we actually sutured the platysmal bands together and lifted from the side. That creates a hammock type effect which will efface the skin and restore a more natural look to her neck. The other thing we did is we pulled her jowls up, and what this did was improve her jawline and fill in that area that's deficient of fat, which was a result of the aging process. And in doing so, we actually changed the configuration of her face. She's now got that rounder, more
Let's
youthful
take a look at that
appearance.
after. Very nice.
I want you to see several things. I want you to notice that her neck looks more effaced and natural. The aging effect of the neck has been greatly reduced.
Looks good.
The jowls and the marionette lines have also been displaced, and they look more natural. Randy, look at the after picture and appreciate that there is now roundness and fullness in the cheek area.
Yes.
But realize it's a natural look. She doesn't look windswept. She doesn't look like she's been stretched back. we have restored a more natural look. When she goes to a party, people say, "You look good. What did you do? What's changed?"
Do they tell you that, by the way? I mean,
Absolutely.
when they come back, they say that?
Absolutely, they tell me, and that makes my day. I know that I've achieved my goal when a patient tells me that they have gotten a compliment and that the viewer, the eye of the viewer hasn't been able to detect the exact reason for this.
Now, you say you change their face, make them look younger, and they start acting differently. Elaborate on that.
When people have cosmetic surgery, it actually changes their self-image. They're not the same person anymore. I've had people tell me that they feel like a different person within months of having a change. That's one of the real tangible benefits from doing this kind of work, that you see improvements, and the patients are actually happier and more energetic individuals following surgery. And I didn't do anything to inject energy into these people.
All right.
But they're feeling it.
Now, you did your mother-in-law's.
I actually did my mother-in-law. It was only
her facelift.
I did her facelift, and I hadn't seen her in a couple of months. And we saw her yesterday, and she, an unsolicited remark. She just told me that, you know, she feels better about herself. She's a different person, and she feels younger. She feels more energetic. You know, it just actually brought this great smile to my face. This was totally unsolicited, and I actually didn't see it coming.
Now, do people dress differently, act differently? You know, I hear with other procedures that even just fixing their smile, all of a sudden they're different. I mean, like a new lease on life.
We have some of the most amazing experiences. We actually have an elderly woman got a facelift, and then we saw her for her 3-month. She had a new hairdo, a new dress, a new tattoo. I mean, we thought she was going to go nightclubbing. It was incredible. She was 82 years old.
82 years old. So what are the age ranges? People coming in for these low downtime facelifts or facelifting?
Well, one of the things that has really changed in facelifts has been the expansion of the candidates. You know, we get people who are 40 years old and we get people who are 80 years old. Now, they don't get the same operation because they don't have the same needs. And some of the old, false assumptions about facelift surgery is, am I too old? Am I too young? Is this too expensive? What are the dangers and so forth? Yeah. And that's the good news in facelift surgery. We do minimal procedures and combined modality treatments for younger patients, and then we do more extensive procedures in the older ones. And older patients, we have the group of primary facelifts, those are the people having a facelift for the first time.
Okay.
And secondary facelifts, people who've had a facelift some years ago and are coming back to see us. Now, they're not unhappy with the first facelift. They just want to look as great as they can be.
Okay.
It's a great recommendation for surgery, and it's a great feeling to take care of those kind of people because there are no surprises. They know what to expect. They tend to be better patients and so forth.
Now, on your website, you have photos all over your website.
Yes, sir.
Of your facelifts. If people are just tuning in, we're talking about how to create a natural-looking facelift with Dr. Derouin, and we should mention. Okay, so you've done more facelifts in the last 5 years than most guys do in a lifetime.
That's
for
correct.
A career. Is that right?
That's right.
Well over 1,500 facelifts.
Yes, sir. That was a big benefit to me and a big benefit to my patients to have this type of experience.
Do people travel to see you?
Yes, I'm pleased to say we have patients from Canada. We have patients from New Hampshire and Texas and California. So we're very, very privileged to be able to participate in their care, and we welcome more. Let's go back and look at that patient that we were talking about previously.
Okay.
And here's a before and after of her profile, and pay attention to what's changed in her neck.
All right.
That neck is cleaned up. You can now see her Adam's apple, which has been lost in action for many years. Okay. And you see a beautiful junction of where the neck stops and the chin begins. And this is what we're trying to achieve.
What do they say to you, by the way? When you're done with this, she's got to be pleased, but...
Oh, she's thrilled. And afterwards, they absolutely notice the neck, and these people now change the clothing they wear. They now they're wearing necklaces, they're wearing tank tops, and they're getting compliments.
Okay, good. Now you have more photos. What are we looking at over there?
Well, here's a lady, and we wanted to include it again to show you her neck angle. And most people, when they get these neck waddles, or what they call turkey gobblers, it's often a straight line, and you can't see where the Adam's apple is. So in this woman, I did a facelift and neck lift.
Okay.
And the bands that you see in the neck and throat area are due to muscles that are subcutaneously located. And I suture those together and tighten them up. And in doing so, it just reveals a nice neckline. You can see the Adam's apple, you can see her jawline. We've improved the marionettes, and we removed the jowls.
Where do you hide the incisions on this?
There's an incision in that natural crease below the chin that everybody has, and it's camouflaged there. Scarring is not a problem for these patients, and their scars are not visible.
So what other photos do you have?
Well, I have another lady. She lives in my neighborhood. She's a golfer. She has some of the same old aging considerations.
Now, was it a coincidence she lived in your neighborhood, or did the neighbors walk over and say, "What can you do for me, doctor?"
Oh, a little of everything, I'm sure. But she was unhappy with her facial aging, and most of her attention was drawn to the neck. And of course, as we mentioned earlier, what we're trying to point out that there are other considerations. She's got problems with her neck, problems with her jowls, and she has a loss of fatty tissue. So what we have to do, the loss of fatty tissue has caused wrinkling in this area. And she's got a straight line from her chin to her chest.
On the before, I could see that, okay.
And what we want to do is give her that natural angle where the neck and throat stop and the chin begins.
Okay.
So in my surgery, I've addressed that. I have raised the jowl up. I've filled in that area where the fat was lost. I've tightened up the neck. And now we get this lovely profile
Very
where we can see the Adam's apple, we can see her jawline in relief, and that line that I mentioned before, what we call the marionette line, it's gone.
So that area right there, yeah.
Here's another patient I'd love to show you.
Okay.
She is very unhappy with how her face is aging. She's had a loss of the fatty tissue and substance in her face. There's sagging of her skin. She has prominent jowling. She has those neck bands that we talked about. She has deep marionette lines, and you can't detect her jawline.
Yeah.
You see
she looks tired. There's no doubt about it.
She looks exhausted. And then here we have her post-operative view. We see a beautiful jawline. There is no marionette line, this little line.
On the side of their mouth.
On the side of the mouth. It's gone. The neck has been restored. She's thrilled, and I'm thrilled because she's thrilled.
Okay.
Okay, let me draw your attention to the upper and middle portion of the face. So you see where this sallow, this sunken look, because we've been able to transfer the fatty tissue and sutured in position, we restore a more natural appearance and fill that deficient area. Okay, here's another patient we'd like to show you. Here again, this is emphasis on the lower third of the face. This patient had that tired look, drawn look. Most of her pathology is in the neck, that marionette line, that fold by your lower lip, and squared off appearance from the jowls. This is an attractive, successful woman, and she wants to look great. And with her, we were able to accomplish this with our minimally invasive facelift, which addresses the lower third of the face.
It's very nice.
So we tightened the neck, we did a little liposuction, and you can readily see that it's a huge improvement for a relatively low time and money investment.
What is the downtime on a procedure like this?
The downtime for our facelift is generally 10 to 14 days.
Okay.
We get most people back to their lives in that period of time.
Okay, and what about your procedures? Where are you doing these procedures? You have your own operating room?
We're able to do most of our surgery in our own clinic. We do these procedures under local anesthesia. The patient walks in and walks out under their own power, and I see all of my patients the next day for the first dressing check. There are instances where people prefer to have a general anesthetic, and if that's the case, we take them to a surgery center when they and where they can have an anesthesiologist attend to their needs.
Now, in this economy, in a tough economy, are you finding that people are, putting this off because of it? Or what's your case for why do something, especially in this economy?
Well, times have really changed. It's not only the economy, but there are more people that are single now as well. And in both instances, these people want to look their best. If you're competing for a job, you want to be that high energy, enthusiastic, attractive person. And if you come in that you look tired, you look angry, you're less likely to land the big job. For many people, the triggering event is a change in their lifestyle. They got divorced, or their relationships have changed. And this prompts them to try to maximize their appearance.
Now, what percentage, by the way, are men and women that do this?
Approximately 15% of our patients are men. But men have problems with cosmetic procedures.
Okay.
They're very concerned about the drastic changes. They're very concerned about overdone looks. And
it can make them look feminine. For a guy that doesn't want to look feminine, that would be my fear.
Yes, but there have been some very famous celebrities that have not turned out well, and I'm afraid that the internet has actually inhibited some of the guys. But many men are pursuing facelift surgery for the same old reasons. They want to look better. They want to land a big job. They're in a new relationship. We're living longer now. We want to look good. When you and I were children, I thought the old people were 40 years old. Now that we get there, we realize that the number's been changed.
60s, 70s young today.
That's right. So for that reason, we believe that the market is expanding. There are more people expressing an interest in facelifting and in other cosmetic procedures as well.
So with men, you have pictures of men.
Alrighty, here's a patient, Randy, a male patient. He's got a lot of things going for himself. He's secure, but he doesn't like this band. It's a muscle. People's attention are being attracted to it.
They're looking at that band.
They're looking at that band, and he wants it gone.
Now, is that an easy one for you to do, by the way?
No, this is something that we can achieve success in almost all the time. We love to see this guy come in because we know we can help him. Look at the after, Randy. This guy looks happier. He looks more youthful. And remember the point I made earlier about aging squares you off?
Okay.
And our surgery restores that oval or round view. And he benefited greatly from that. And he no longer has this band hanging down his neck.
Especially in a shirt. Guys that have to wear collars or ties.
Absolutely.
This is a huge thing for everybody.
Absolutely, it's a big deal. And in Arizona, where I live, open necks reveal even more.
So take me through the consultation process. We're just about out of time, probably have a minute and a half, 2 minutes left. A patient goes in to see you. When you look at their face, what are you looking at?
I start at the top. I look at their brows and hairline. I look at the position of the eyebrows, the eyelids. Are they hanging on the lashes? Do they have little fatty sacs protruding in their lower lids? Then my attention is attracted to the midface. Have they lost substance? Have they got hollowed out cheeks? As we go down, we look at the nose, we look at the upper lip, the lower lip, and then our attention is directed to the jawline and the neck. And our procedure, we have procedures for each of these areas. We can do brow lifts. We can also do eyelid surgery we call blepharoplasty. We can take care of the nose if you so desire with rhinoplasty. But our big procedure is facelift surgery.
Now, are you doing mostly a combination of procedures? That means that, you're addressing the skin as well?
Yes.
There's almost every person that comes in, if they're getting a facelift, they're also doing laser or something for their skin?
We're recommending skin care in nearly every patient we see. We can all benefit for treating our reds and browns that we all have. But the emphasis is on the facelift is restoring the neck, filling out the cheek, elevating the jowls, eliminating those marionette lines. After surgery has been completed, that's when we try to address the skin, and we have lasers and IPLs and a number of other modalities.
You're known for your natural results. What do you like most about facelifting?
I love to see a natural appearance in a patient who feels great about themselves following surgery.
Okay, good. Final message. Somebody watching this, Maybe they look in the mirror, they see their mother, they don't like the way they're aging. What do you say to them? What's the first move?
Come in for a free consultation. We'll discuss it with you. We'll show you pictures, and we'll review what you look like on our screen. And we'll be able to help you.
Okay, good. I want to thank you so much for coming on the show. Very interesting. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you go to our website at wellnesshour.com. Just put in facelifting or low downtime facelifts. Of course, Dr. Derouin, maybe tough to spell Dr. Derouin, but they'll be able to find you there. And always a pleasure. So they can go to your website, they can see all of these photos, and you do all your consultations. They meet with you.
Yes.
And your wife works there, and so it's Dermacare.
Yes, then the website is azdermacare.com.
All right, thanks again. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.